Hello, my name's Simon Matthews. I'm a psychologist by profession and I hold board certifications in both lifestyle medicine and health coaching. I'm a fellow of the American College of Lifestyle Medicine as well as the Australasian Society of Lifestyle Medicine. Australia is the country from where I'm speaking with you right now. I consult and teach internationally in the areas of behaviour change, lifestyle medicine and positive psychology, and I also hold an adjunct academic position at Avondale University out here in Australia. If you would like to take steps towards greater health and well-being, and if you'd like to improve your overall health, there are some things to really keep in mind as you do that. The first is to remember the things that actually contribute to good health and well-being. And they're the principles that we often talk about as lifestyle medicine. So they're things like getting good quality sleep and getting long enough sleep, making sure that your diet is good, making sure that you move a lot through the day, making sure that you make time for exercise and activity that makes you work a little bit harder, makes your heart pump a little bit harder. And importantly, also making sure that you have some really strong social connections to people who are important to you in your life. That can be family, it can be friends, it can be work colleagues. It doesn't really matter as long as those connections are there. If you're working consistently towards all of those things, then you've got a really good foundation for improving your health and well-being. Beyond that, it's important to create a bit of a picture for yourself of what you would like to be able to do with your health and well-being in the future. To do that gives you what we call a sense of purpose or a why to making changes to your health behaviour. So rather than just saying to yourself, oh, I should lose some weight, or I should go to the gym, or I should get more sleep, or something like that. Think about, why do I want to do those things? What will my life look like when I'm doing more of that? What will be improved or better about my life? What would I like to be able to do in the future as a result of doing those things? And if you keep that future picture in mind, it really acts like an aiming point or a goal that you're moving towards in your health and well-being. It's important to recognise that behaviour change occurs in small steps. There are not many people in the world who take one big leap towards a health behaviour change. It's small steps over, an extended period of time. And as part of that, it's important to acknowledge that you're making progress in those small steps, and also to celebrate that progress, to be very positive about that progress that you're making. Sometimes people diminish small steps and shrug their shoulders and say, oh, well, it's only a little change. Well, that might be true. It might only be a little change, but a lot of little changes put together make up a big change. Remember to learn from what you're doing, particularly learning from what you might consider to be mistakes or errors along the way. Difficulties that we encounter, obstacles that we encounter, mistakes that we make, slips that we make in behaviour change, they're all powerful teachers. And if we can adopt a mindset not of criticising ourselves for making mistakes, but instead adopt a mindset of asking, what can I learn from what's just happened? Then you set yourself up for even more powerful behaviour change in the future. And the last thing that I think is really important in the process of behavioural change is to remember those social connections. Remember the importance of being in relationship with others. Share what you're going to do with others. Tell other people about what you're going to do. Seek support from others. Ask friends for help. Ask family members for help. Look for ways that you can get support to do the things that you want to do that are really going to advance your own health and well-being. Intergenerational social connections promote longevity in a number of ways, and some of them a little bit complex, and others more straightforward to understand. Probably the first and most important way is to remember that social connection for all of us provides a sense of belonging. When we have social connections, whether that's with friends, family members, work colleagues, relatives who are older than us, relatives who are much older than us, for example, parents, grandparents, even great-grandparents, we really get a sense of our place in the world. We get a sense of where we fit, how we fit, who we belong to, and even we even start to answer questions for ourselves like why we're here. And that's that question around purpose. What can I do here that's going to make a difference? What can I do that's going to change something for good or change something for better? So social connection, and particularly the intergenerational social connection, really helps to foster that. A second important element of intergenerational social connection is that it gives us role models. It gives us people in our lives to whom we can look and kind of say to ourselves, I want to be like that person. I want to be like them. Look at what they're doing in their life. I really admire what they're doing there. I have people like that in my life, and those people don't even need to be your direct family members. It can simply be an intergenerational connection, even if it's a friendship rather than a family connection. But having those people to inspire you in that way and to give you something to copy and to repeat in your own life is really, really valuable. There's some really interesting evidence around the important role that social connection plays for our health. And in particular, there's been a very long-running healthcare study in the United States of America, which has been going now for over 80 years. And it shows every year the importance of social connection for health and well-being. And some of the reasons for that are that social connection, that intergenerational social connection, helps us to be more mindful about our own health. It seems to help us think more deeply about our own health. It's almost like when we feel that sense of connectedness to other people, we feel like taking care of our health and well-being is just a little bit more important. So we're more likely to make decisions that are good for us, that are good for our health, good for our well-being. We're more likely to seek healthcare assistance if we need it. And we're also more likely to show that support for people around us. And this is the lovely part of social connection, I think, that social connection and intergenerational social connection is not only good for me as an individual and you as an individual, but when we start to experience the benefits of it, we start to repeat those benefits for other people as well. So we can end up doing something really powerful that makes a wonderful difference to someone else's health and well-being just by maintaining those connections ourselves. There are a number of positive psychology techniques that healthcare professionals can adopt. And one of the things that I want to say right up front here is that when healthcare professionals are aware of these strategies and these techniques, they can apply them both for the benefit of patients and their own benefit as well. This is one of the delightful things I think about positive psychology approaches, that as professionals we can make a powerful difference in the lives of our patients and clients, and if we choose to follow some of these strategies ourselves, we can make a powerful difference in our own health and well-being. So some of the really well-known positive psychology approaches, of course, are things like focusing on strengths, identifying what your strengths are, and, if you like, playing to those strengths, making use of those strengths. There are inventories around that you can use to help you identify your own strengths. Even if you don't use an inventory, you probably just have an experience yourself of things that you're good at, things that come easily and naturally to you, things that you can really build upon in your daily life. So making use of strengths is wonderful. I'm going to suggest that we need to counterbalance that, though, with also not forgetting sometimes to use our lesser strengths, because when we use lesser strengths, we help to build those up. And this is important with patients as well, encouraging patients to look beyond the things that come easily to them, to the things that they might have to work a little bit harder to accomplish or achieve. The analogy that I often use here is an analogy of gym training. When you go to the gym, you don't just do the exercises that come really easily to you, because you want to build up the muscles that aren't as strong as the others. And to do that, of course, you need to do things that aren't quite as well developed for you. So working on strengths is one. Mindfulness is another great strategy. One of the criticisms of mindfulness in the literature is that we don't really have a clear definition of it. I'm going to share with you a working definition that I find really helpful, and that is the idea of simply bringing your full attention to the present moment, bringing your whole attention to what you're doing right now. And if you can make a practice of that in your professional life and in your personal life, and you can encourage your patients to do that, that's a wonderful technique for improving health and well-being. Showing gratitude for things that you experience in your daily life is a lovely positive psychology technique. This is very, very easy to do. You can encourage a patient to get to the end of each day and simply name 3 things that they're grateful for that day. And while you're at it, when you get to the end of your working day, pause and call to mind 3 things that you're grateful for in that working day as well. Wonderful way of harnessing the impact and the power of positive affect or positive feeling. Acts of kindness towards other people, lovely strategy to use. And in a similar vein, volunteering, donation, and so on. All of those things together, kindness, volunteering, donation, they're all pro-social activities that support the production of positive affect and support the experiencing of positive affect. Just as easy to do yourself as it is to encourage your patients to do that. So a number of things from the field of positive psychology that you can use with patients, and importantly, use with yourself as well. There are a number of different behaviour change therapies that a clinician can use. And in fact, one of my favourite research papers on the topic speaks about 82 different theories. And in fact, no one, of course, can learn and practice 82 different theories. By the end of that particular research paper, the authors then say that there are 83 theories, which to me conveys the idea that new theories are being developed so quickly. In the time it took them to write that one research paper, someone else invented another behaviour change theory. We don't need to learn 82 or 83 different theories. There's no particular value in that, but there is value in understanding some really important principles of behaviour change that are embedded in some particular theories. The first principle comes from the research called the common factors research, which has been with us for a number of decades now. The common factors research essentially points to the biggest factors that lead to long-lasting behavioural change for patients. The first one of those factors is the clinician's capacity to make use of the resources that the patient has. So this means that we as clinicians need to be curious about the resources that patients have. We need to ask questions about that. We need to encourage our patients to develop their own learning mindset about this and to seek to develop more tools themselves. The more tools that a patient has, the more aware they are of them, the more likely they are to be able to get a good outcome for themselves. The second factor, almost as significant, is what we would call the therapeutic alliance, the relationship that a clinician can cultivate with a patient. So this is where we think about things like warmth, empathy, friendliness, attentiveness, care, compassion, kindness, professionalism. All of those sorts of things help to build confidence in the patient that the clinician is someone trustworthy and knowledgeable who is going to be able to support them. Interestingly, that also supports the third element of common factors approaches, which is the development of hope. And hope is a really important factor for patients. Simply being hopeful, or other language that we might use here is the placebo effect, believing that a particular intervention is going to be useful, does play some role. It does have an influence in outcomes for patients. So being aware of those three things together is a very, very important starting place. Number one, harness your patient's own resources and skills and help them to develop more. Number two, focus on the relationship that you have. Focus on developing a caring, kind, empathetic relationship with your patient. Beyond that, there's a particular theory called the trans-theoretical model of change, often called the stages of change theory, which is very, 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 very valuable for clinicians. And it's valuable primarily because it helps us step away from the idea that people either are changing or are not changing. And sometimes we can fall into that view that change is binary. You're either doing it or you're not doing it. And in fact, the trans-theoretical model of change, the stages of change model, helps us to see that people move gradually along a pathway towards greater states of readiness to engage in a behavioural change. And having that mindset or that framework is a really valuable framework to have for supporting people to engage in behavioural change. And it's valuable because it helps us to tailor our particular responses depending on where the patient's thinking is up to. If someone is very, very uncertain of their capacity to make a behavioural change, then the response we might make there is very different from a response that we might make to someone who is very certain of their capacity, ready to go, ready to start setting some concrete goals for themselves, and so on. So that idea of tailoring our approach fits really nicely with the trans-theoretical model of change. Some other principles that I think are important are the principle of acknowledging small change. Patients often come to us with quite a sense of frustration about their health and well-being and expressing ideas of a desire for a significant change in their life, which might be, feeling much healthier, or it might be a significant weight loss, or it might be a significant exercise goal that they have, or something like that. And those goals are wonderful, and we should certainly support our patients to keep those visions in mind, and at the same time make sure that we're acknowledging, encouraging and celebrating small change along the way. And the other principle that's really valuable, I think, in behavioural change and embedded in a number of behavioural change theories is the idea of collaboration. Seeing ourselves less as treatment providers and more as collaborators with a patient. Seeing ourselves less as the people with the answers to give the patient, and more as people who are working with the patients, working alongside the patients to support them to uncover the tools, the techniques, the strategies, the resources, the skills that are going to be meaningful to them and help them embed long-lasting behavioural change.